Thank you so much, John and Sam. Can everybody hear me well?
Yes.
Good afternoon, Behtash.
Right, so I'm going to go ahead and share my screen here. So as John said, we're really going to be talking about patient centricity and how it's been introduced in various different forms across the process of developing new treatments. This is meant to be sort of a introduction, a 101 in patient centricity. So I'll try to hit on as many different aspects of patient centricity that I know and that the organization that I work with, CISCRP, has had experience in, but it probably won't cover every single aspect. But I am very excited to talk to you guys today, and hopefully what you get is that high level overview, as well as some really sort of practical and specific practices that you can put into play in the research and the work that you all are doing, which is just so important, especially at a time like this, to help improve public health. So I'll begin by just giving a quick introduction about CISCRP. I'm not sure that everybody is aware in the audience. So CISCRP stands for the Center for Information and Study on Clinical Research Participation. We are an independent 501c3 nonprofit organization. We're based in Boston, but obviously everybody is working remotely right now. But we're globally active. A lot of our programs have reached participants and members of the public all around the world. And I'll touch on what some of those activities are. We have been working since 2003 towards our sort of high-level vision of having a clinical research process that is dedicated to being in partnership with patients and the public. And that sort of is a good mantra for patient centricity. You don't just want people to feel like they're a part of the process, you actually want them to truly be a part of a process, not just as participants, but as partners. CISCRP has worked with a variety of different organizations. You could see it there, but we do work mostly with industry, and a lot of the sponsors, research sponsors that are out there, have worked with us to help implement some patient-centric activities. So I hope to bring a lot of those insights and knowledge here, but again, at a high level. So this, I like to view this as sort of a roadmap, a beginner's guide to patient centricity in clinical research. Patient centricity sometimes is not really a perfectly well understood term. There's a lot of sort of offshoots of it. Patient engagement is another one. But in the end, ultimately, one way to look at it is educating and engaging people at all stages of the clinical research process to improve the experiences that participants have and caregivers and their families have with clinical research, to improve their understanding of clinical research, and also to improve their decision making, which really speaks a little bit more to the idea of health literacy. And in order for folks to make decisions and really positive decisions related to their health, they need to be able to access and understand information. And so you'll see how that's weaved into this higher level idea of patient centricity here. The way that I view this and the way I broke it down here is really from the perspective of a participant. And for them, there's sort of three stages in participation. It's before, during, and after they are in a trial, right? And you see each of these bullet points here sort of touches on one aspect of patient centricity and all of them are really important. Some of these have really come to light more recently amid the COVID-19 pandemic. And you've heard some speakers today, particularly Nancy, talking about a couple of these aspects that I'll touch on as well. But from the very beginning, when we're engaging with not just potential participants, but the public in general, what we need to do as a research enterprise is raise awareness about clinical research, about what clinical research is, and it's the critical importance of research participation towards the development of new medicines. And together with that awareness raising, we have to provide clear education. I'll talk a little bit more on that here in a second. One thing that I'm not going to talk too much about in this talk, but others have certainly covered it, and I'm sure you've heard others talk about it, is essentially bringing trials to patients, right? So the second bullet point is about alerting patients to trials using database technology and also healthcare professional engagement. So we know of a lot of different organizations now that are leveraging EMRs and sort of coagulating these AMRs, electronic medical records, to identify potential participants for trials and really bringing those opportunities to the participant. And really important in that process of decision-making for a participant when it comes to the introduction to clinical trials is their healthcare provider being involved. Not very many healthcare providers are actually, actively involved in clinical research. They don't, for a variety of different reasons, necessarily even consider that as a treatment option for their patients who do not have treatments that are working well for them. And so that is believe it or not, although healthcare professionals are not patients, it is one aspect of patient centricity to engage with that audience. I'm not going to go through each and every one of these bullet points actually, because I'm going to talk about them later, but another one here that I'm not going to cover too much is reducing trial participation burden through the use of virtual and mobile trials, as well as at-home technologies. This is really the aspect where we see COVID-19 has sort of just hurdled the research enterprise towards this shift in the paradigm of how research is conducted. Brick and mortar research is always going to be a part of treatment and drug development. However, now I think we're learning how much can actually be done virtually, how much can be done with at-home visits or at-home technology. And these are, as is the case with almost every aspect of patient centricity, something that benefits the clinical research sponsor in accelerating the development of trials and potentially reducing the costs of trials when they run too long. It actually benefits the participants as well, and it benefits the patients as well. So it's really mutually beneficial to explore these options, explore ways to improve trials for participants, because it almost always does lead to a direct benefit back to the sponsors. There has been some research done, and there are some publications out there. If folks are interested, I'm happy to refer you to them. But they actually look at the return on engagement. It's sort of a new measure that's been developed and coined so that sponsors can actually look at, if we invest in these patient and participant engagement activities, how does that reduce timelines, reduce costs, and ultimately down the line, even in post-marketing, improve margins in terms of the return on investment there. So I'm going to keep most of these things for later. Last one I'll just mention is coordinating return to standard care. It seems like a common sense thing, but sometimes, many times after a participant ends their part of a trial, they're actually completely cut off. We've heard testimonials to say that it sort of feels like they've been broken up with over text. And that's not what we want, right? We want them to not only feel like they are appreciated for what they've done and that they've made a difference, but also we want to sort of smooth the process of them returning to standard care if that's something that they will be doing. Or if not, how are they going to continue to have access to this medicine that they may have been trying during the trial? So I mentioned education and awareness. There's a lot of different ways to engage with the public and patients and to make them aware of clinical trials and to, again, raise their levels of what we call clinical research literacy. But really the sort of first stepping stone is just improving public perception about clinical research. There's still a lot of misconceptions. And we want to address those. We want to, demystify those myths or debunk them. And so CISCRP has done that, and a lot of other groups do that through things like media outreach, takeaway content like brochures, books, and posters, but also educational videos and webinars. In this day and age, of course, you have very limited time to try and make a very quick impact on the viewers that are out there. So brief educational videos might be a really good way to go. Whereas there are some audiences, and again, this is one aspect of patient engagement or patient centricity, there are some audiences that won't necessarily be as technologically savvy. And so understanding that you need to reach different populations through different means is another aspect of patient centricity. One thing that I'm going to mention here and is really, really critical, we're talking about it here in the context of media, media campaigns and education and awareness, but patient diversity and inclusion in clinical trials is absolutely one of the most critical aspects of patient centricity that is at the forefront of people's minds right now. I don't have to tell this group how important it is to have a diverse range of individuals that represent truly the demographics of the target population, the patient population for that intervention. But for some reason, it's taken decades for us to really, really try to, have practical solutions to that issue. There are many different groups that are working on patient diversity campaigns, and there are best practice and multi-stakeholder groups that are developing guidance on how to improve diversity. So there's a lot out there to help you do that. And I suggest if that's not at the top of your agenda right now in your research programs, then it should be introduced there. There are also really innovative ways to educate and engage with the public. CISCRP has worked with some sponsors to put essentially a mobile education unit. You see it here as a food truck. It's converted into just a rolling library almost of educational information about clinical research. There are videos you can find on YouTube and on the internet that capped that project, as well as another project that we did, which was the MT Pharmacy. That's a play on words. Without giving too much away, it was meant to show that without the really important medical heroes, the clinical research participants who take part in clinical research, we would not have any medicines to help treat patients. And so that was a pop-up that was set up in a metropolitan area, and really, again, a very innovative way to raise awareness about the critical importance of clinical research and participation in trials. Sponsored websites are also becoming, I shouldn't say becoming, have become a very important ways of interfacing with patients, the public, caregivers, etc. It's a way of improving clinical research literacy, having educational content, making finding trials easier. So actually embedding search tools that specifically search for a specific sponsor's trials, because we all know ct.gov is not patient-friendly. It's not user-friendly, even though they continue to say that it is. And also these websites have become a means for sharing aggregate results, whether in technical format or plain language format, which I'll talk about here in a couple of minutes. One really important thing to mention here is these sites do need to be completely separate from corporate sites. There actually shouldn't really be any linkage between the two. And that's so that these sites remain non-promotional. Historically, sponsors have been very hesitant in this highly regulated environment to have any type of direct interaction with participants. And so having third parties, patient advocate groups and other organizations as a buffer is obviously one really good strategy. But then also you just want to make sure that you have that separation from any corporate or promotional sites, so that you will not be found to be in violation of any ethical practices. We had a speaker, and I believe it was Nancy. She talked a lot about informed consent. And there are a lot of innovations that I'm sure folks have heard about here. But I'll just talk about two important things here. Why do we want to make informed consent more understandable? Well, one thing from the sponsor's side is improving adherence. We know that patients have a hard time with the legalese that is typically found in ICFs. They don't really understand the trial very well, and therefore they don't understand what's being asked of them. So the better that your informed consent is as far as being understandable, the more likely it is that that participant is going to adhere to the protocol essentially, and also stay in the trial. The retention is going to be higher, most likely, if you have individuals that fully understand what's going to be asked of them and what they have to do. And so in order to do that, you apply best practices in health communication. You want to have navigable either documents or electronic applications. You want them to be visually engaging. So things like table of contents help it be navigational as well as headings. Using appropriate colors and appropriate icons also helps. Graphics, infographics, that's also going to help. One thing that the Common Rule introduced, and this is really for federally funded studies, there is a key information section required at the beginning of an informed consent sheet. And that sort of highlights the issues that there are with informed consent. These things are so long and there's so many disclaimers that are necessary from a legal perspective for the sponsor that are just not as important for a potential participant in their decision-making process. And so the Common Rule has asked sponsors to move key elements up front so that those can be the first things that a potential participant reads. Now we know the informed consent document or e-consent application itself is just part of the process. There are other ways too, like teach-back mechanisms that the study site staff can implement with the potential participant or their caregivers. These things help to ensure understanding. So it's not just about the document. It's not just about how well the study coordinator is communicating with the participant. It's about almost testing whether there is actual comprehension of these things. And so that's what teach-back methods will do. The last thing that I'll mention here, and it's related to why education is so important, when a potential participant is introduced to a trial, that should not be the same time that they're given an informed consent document. They are already under so much emotional distress. They do not have really the best opportunity to truly understand what clinical research is at that point. So much of what goes into informed consent documents now that we work on at CISCRP, so much is just explaining basic elements of clinical research that are much better suited to be introduced to individuals well before they need to go into a trial. And so that's another aspect to keep in mind here is, yes, make your informed consent documents better or your process better, but also make sure that you're doing your part to introduce the general public and patients to the ideas of clinical research earlier so that they better understand what it is when they're going through the informed consent process. I mentioned earlier trial result communications. We hear repeatedly that participants want to have results communicated to them and they don't have that. There are now regulations in place for sharing aggregate results in the European Union, or actually there will be regulations in place, requirements for sharing aggregate results in a plain language summary. In the United States, that is not a requirement, but it's also not disallowed. It is absolutely a good patient-centric sort of activity. And it's not just aggregate results at the end of a trial, but also individual results that participants have. They don't just want to know what happened in the trial overall and what are the next steps. They also want to know, well, what were my results? What did you learn as far as my lab and my testing? And these are things that sponsors are returning back. It's very challenging to do. Again, there are guidance documents out there and organizations that can help with this, particularly with the idea of making these things easy to understand, unbiased, and completely non-promotional. But it's a critically important aspect of any patient-centric organization. Another very underappreciated activity during a trial is simply thanking and recognizing participants for their role in advancing medical science. The impact of something as simple as a thank you card, it's a postcard that says thank you, gives them an update on the trial, sets expectations for receiving results at the end. The impact is almost immeasurable. Because we know that participants generally have really good experiences during a trial, and we want to reinforce that by thanking them at the end of the trial or during the trial. Unblinding participants, sharing treatment assignments is also another activity that can be done through this type of communication, and some may actually call that one of the individual results communications. But let's tell participants what they took during the trial as well. Again, seems like a simple thing, but historically not taking place. Now, I've talked a lot about engagement and sharing information, communication with patients, the public, and participants. However, probably the most critical aspect of being patient-centric is involving patients throughout the process of research and development. This is an excellent sort of diagram that Upati has put out, and it shows how all the way back as early as setting your research priorities, going through your research design and planning, through to the actual conduct of the trial and afterwards, how you can involve patients. Now, this is not just patient experts, right? There are patients who are experts, but you also need to just talk to, Uncle Joe and Julie and Jill. These individuals who are members of the public and are new patients and don't have a lot of experience, they can give you incredible insights. I'm not going to go through every one of these points here, but I do hope that folks take this back and take a look at how, when they can involve patients in their research conduct. Now, what do I mean when we talk about involvement? Well, here are some very practical ways that CISCRP helps sponsors and how many other groups are helping sponsors. Patient and community advisory boards. So we actually will bring together a group of patients, caregivers, other stakeholders too, if it makes sense for the purposes and the goals of the project. And then we're going to gain insights from those individuals, those patients, those caregivers, on their experience of diagnosis, their experience in clinical care and treatment. What are their perceptions of clinical trials? They're going to help actually shape your trial awareness and recruitment strategies. They can help test your informed consent documents. And very, very importantly, put the protocol, a draft protocol, or at least some of the procedures in front of these patients. Let's ask them, how can we reduce the burden on those participants through streamlining some of the procedures, for example. Over the last 10 or 20 years, the practice of adding on measures, especially exploratory endpoints, has become sort of maddening. There is a lot that's done, understandably, but that is not necessary from the patient's perspective, and that does impact their experience. So one thing that is really important is making sure that you are actually testing your protocol, reviewing your protocol with these participants, and having a dialogue. Don't try to extract information. Let them speak to you and learn from them. One important aspect of the protocol is that we all know, and I'll just point this out, but I won't give any more information about it, is patient-reported outcomes. One of the best ways to identify what PROs you need to have in a trial, and even developing new PROs, is through advisory boards. Journey workshops are also another great way. So participants who have gone through a trial, ask them what their actual trial experience was like and what their ideal trial experience was like. This will identify very specific points for improvement and even some points of success, which is always important, right? I guess I should pause here. I always say, we have done so much work in clinical research over the past 20 years, or even going back. A lot of these patient-centric activities have been put into place, maybe, in sort of disparate manners, particularly when it comes to oncology, for example, and rare diseases. But there's always more to go. There's always more to do. And so I don't want to sound like I'm saying, hey, nobody's doing this and we're not doing well. But we can always improve the experience that patients have. And one way to do that is through these patient and caregiver journey workshops. So other ways of gaining patient insights, it doesn't have to just be those advisory boards and workshops. You can do it through telephone interviews, online surveys, social listening, even literature reviews. But basically put in the work to understand the impacts on a patient's life of not only their disease and their diagnosis, but also of taking part in a trial. Now, there are a lot of groups out there, and CISCRP is one of them, that put out publicly available insights from participants as well as members of the public on what they feel about clinical research, what their experiences are. So I encourage folks, take a look at these, the results of our 2019 global survey. This is the 4th iteration of our biannual survey. We do typically have over 12,000 respondents. There's 4 different publicly available reports. We do have much more data behind that. So if anybody's interested in learning more about how we can share that data with you, please do reach out. And another thing that I just wanted to share very quickly here, we did do, much like other organizations, a COVID-19 survey to assess the impacts of the pandemic on clinical research attitudes and experiences. As you might expect, participants have obviously had to go through a lot of disruptions in clinical research. and members of the public still don't have very good understanding of what clinical research is. So actually, I would say the time to act is now. There is a lot of heightened interest in clinical research, so putting out the education, engaging with people, it's really no time like the present, truly, for us to improve the experiences and the understanding of the public and patients in clinical research. So I thank you all for your attention. If there are questions, I'm happy to answer them now, or feel free to reach out at any time. Our goal at CISCRP is, as I said, to improve the experiences that patients and the public have with clinical research. So any way I can help, do let me know. Thank you.
Thank you, Behtash. That was a very good presentation. We do have a question, and the question is, what if the test results, such as genomics, are based on RUO assays rather than CLIA CE marked assays?
So that's a pretty technical question. I would say, one of the things, this is obviously relating to individual return of results, right? Especially during the trial. The Multi-Regional Clinical Trial Center has put out a pretty good guidance document on return of results, as has the National Academies of Science, Engineering, and Medicine. Actually, and the second one there, they have a full volume, a full book on it. Some of the sort of technical and also ethical considerations might have to be left in the hands of the investigators, or even communicated to that patient's regular care provider. So the technicalities of it and sort of the logistics around even not just the logistics of sharing it, but whether to share some information or not, is still, I'd say, in the earlier stages. So there's some precedent out there. I do appreciate the question, and I love that you're thinking that far ahead. You may find that there's not a sort of a tested answer out there, but that doesn't mean that we shouldn't push forward and move towards getting that really good answer.
Okay.